the Armenian American Medical Society, as well as the Armenian Bar Association. We just went live on Facebook as well. I'd like to welcome our audience both via Zoom as well as on Facebook. For those of you who don't know me, my name is Dr. Viken Sepilyan, and it is a distinct honor to be serving as the Continuing Medical Education Chair of the AAMS, as well as serving as a board member. It really is an extra pleasure and honor to be bringing this webinar to you, sitting right next to a dear friend, a colleague who we have collaborated our sibling organizations in various events, going back as far back as a decade. For those of you who don't know who I'm talking about, you know, Mr. Gerard Kasabian is the chairman of the Armenian Bar Association, and it really, you know, I'm truly honored and that we continue to do these collaborative events of our sibling organizations. Mr. Kasabian, thank you. I'd like to thank you and commend you for all the accomplishments of the Armenian Bar Association and all that you've done under your leadership, and what you've done to champion these types of collaborative events with like-minded professional organizations such as the Armenian American Medical Society. Tonight will be the 20th webinar that we have done as the medical organization, and we really are honored to be sitting next to the Armenian Bar Association. Tonight, we're going to touch upon various issues that pertain to employment law, both from an employee and employer standpoint. And this really was a brainchild of Mr. Kasabian when we were talking about various issues that may be impacting professionals and their practices. Giro, as I know him, or Gerard, pointed out the importance of, you know, employment law has two sides to it, both from an employer standpoint and an employee standpoint. With that, I'm going to ask Mr. Kasabian to go ahead and take over the platform and introduce tonight's program and introduce our speakers and get the show on the road.
Thank you. Thank you, Dr. Sepilyan. The feeling is mutual among all of our Board of Governors of the Armenian Bar Association in being honored to share the platform with the Armenian American Medical Society. As always, we're happy to stand shoulder to shoulder with our professional brothers and sisters. The Armenian Bar Association, for those who don't know, is a nonprofit organization established in 1989. We're the largest organization of judges, lawyers, professors, and students. It's designed to share information and to exchange work knowledge, and also to help the students elevate themselves from one level to the next, and hopefully to become a judge or a professor one day, or one of the star professionals in our legal field. Today we have two stars that are with us. They are Nancy Doumanian and Michael Manoukian, both of whom are well known in our communities for being experts in labor law. I will allow them to make their introductions instead of reading bios, so that we're more efficient. Their bios are available on our respective websites. Ours is armenianbar.org. And by the way, we are sharing the Zoom broadcast on Facebook Live right now. And if you hear repeats of the noises, that's because we are sharing as we're going along. And I apologize, because I was guilty of doing that as well. Without further ado, I'd like to welcome Nancy Doumanian and Michael Manoukian to present themselves to our audience. And Dr. Sepilyan and I will be in the background watching. And also, if there are any questions during this webinar, we welcome questions through the Zoom platform, and also questions that are posed on Facebook on the Armenian Bar page or on the Armenian American Medical Society page. We will try to read these questions after the presentations are done. We thank everybody for being with us tonight. It's the 20th for the Armenian American Medical Society, and it's the second one for us. And it's an exciting new way of presenting and having a global reach for such important topics. Thank you, everyone, and welcome.
Thank you so much, and good evening. And thank you, Viken and Gerard, for giving Michael and I this opportunity. I'm Nancy Doumanian. I am a civil litigator. My office is in Pasadena, California, and I practice civil litigation and labor and employment law, representing both employers and employees. Michael, I'll let you introduce yourself as my colleague in this event.
Thank you so much, Nancy, and good evening, everyone. My name is Michael Manoukian. I am an attorney at a law firm called Hopkins & Carley in the Bay Area. Hopkins & Carley has offices in both San Jose and Palo Alto. I focus my practice 100% on advising and counseling employers with everything related to employment law, wage and hour issues, discrimination, harassment, executive agreements, separations, etc. I also want to say thank you very much to Viken, Hasmik, and Gerard for having Nancy and I on the panel tonight. It's a real honor to join you all. Thank you.
So we're going to start our conversation tonight addressing different topics. And as Gerard and Viken mentioned, there'll be a question and answer session at the end. So we wanted to start with California by the numbers and take a look at the important numbers and dates that have brought us to this point here. First, it's important for everybody to take a deep breath and to kind of navigate ourselves in our different professions and jobs and homes and work and lives and adjust to this new normal. These are some statistics as of last Thursday, I believe, and this is just unique to California. Total number of diagnosed COVID cases, 151,829 plus. Deaths, sadly, 5,082. And this all began on March 19, 2020, when our governor issued an executive order, which was the safer at home, stay at home order. Some people call it quarantine or lockdown. That really changed the face of businesses, both from the employers and employees perspective. And what it did teach us is that it's really important that we work together as employers and employees and collaborate so that we can, as now we re-enter the workforce in phases, that we could do that in an informed, humane, and compassionate way. But what we do know about these, the way COVID has affected the law is that employment law, and I think what makes it very interesting for us who practice it, is that it is it's not a black and white area of law. It's a very gray area. And the law is constantly changing, and it's even more challenged now. And Michael and I kind of anticipate there's going to be a big influx of litigation because there isn't laws right now that tell employers or employees exactly what we do, how we return to work, and what our rights are in this new workplace. So the potential litigation is really significant. So what we want to do tonight is just touch upon different aspects of how COVID has affected the workplace from the employers and employees perspective, talking about return to work, changes in employment law to the extent there really are some. There's a lot of new laws pending. Talking about unemployment benefits, how that affects both employer and employee perspectives, and then going into workplace accommodations and how do we view that from both the employer and employee perspective. And then Michael will share some of his closing thoughts with you before we go into the question and answer session. So I'll turn it over to Michael on returning to work.
Thanks, Nancy. Yeah, just to dovetail on what Nancy was speaking about, I think when we were preparing for this presentation, one of the challenges that we're presented with is that all of you in the audience are sort of spread out in many different geographic areas. And based on your location, it's important to understand that there is going to be just a huge flux of new laws that have been passed in the last 2 months, 2.5 months, and also laws and orders that you're going to have to comply with as a business that haven't come out yet, that we expect to come out in the coming days. So it's important to understand that our comments and our advice during this presentation are much more high level than probably what you might need with specific questions that are refined to, you know, who your staff is, what your office looks like. So at the end of the presentation, and as Gerard mentioned, we're going to share our contact information. If you have more detailed questions, please reach out to us. California, of course, like always, is sort of the Wild West, and it does its own thing in comparison to federal law. But with this COVID-19 situation, you know, we have orders from the governor and from the state level, but we're also now seeing lots of new laws and regulations rolling out at both the county and the city level. And so that's important to understand. The most important thing to remember, and I'm sure you're all here because you want to get back to work if you haven't already, or if you are back to work, you want to understand what laws are in play and what you need to do to be in compliance to protect your employees and to hopefully get back to your revenue streams that you were enjoying pre-COVID. I think one of the most important things that Nancy and I wanted to convey to you all is the topic of collaboration. As employers, as businesses, and as employees, I think an open dialogue about sort of the new era, what the new workplace looks like, is very important. So everyone feels comfortable getting back into the office, and you all can focus on your business and not on this whole mess of laws that we're going to be talking about. Likewise, I mentioned I represent employers in litigation advice and counsel. Nancy does a little bit of both. Regardless of what side of the table you're on, you can go on Google or Yahoo or wherever, you're going to see a tidal wave of litigation and lawsuits being filed, and they've already hit the courts, frankly, tied to COVID-related issues. So the next 6 to 12 months of your business, you really want to focus on staying out of the courtroom and focusing on your practice if you're in the medical field or whatever business you're a part of. Some of the new laws that have been rolled out are sort of all over the place, but from varying organizations and departments. For instance, you're going to need to look at new OSHA regulations that were rolled out, advisories from the Center for Disease Control, the CDC, guidance and laws from the Equal Employment Opportunity Commission, which is a federal body that regulates employment, and also the Department of Fair Employment and Housing at the state level. The Department of Labor is also another organization that has rolled out new laws and extensive FAQs about how to comply with all the new laws that have been rolled out that are related to COVID. You're also, as I mentioned, going to need to look into things like executive orders from the federal government as well as from the state level and the governor's office. And then on the micro level, there are county-specific regulations, advisories, and laws that you need to be aware of and make sure to comply with. Some of these laws, more specific, that we think are going to pop up with respect to COVID have to do with leaves of absence, paid sick leave. There are some significant changes in counties like San Jose or Santa Clara County, where I practice, San Francisco and the city of Oakland, down in Southern California, the county of Los Angeles, as well as the city of Los Angeles and the city of Long Beach have all rolled out their own set of paid sick leave laws. They're very much tailored around the federal laws, but you just want to make sure that you are complying with the laws that apply to your business. Lastly, because of the whole return to work, the topic of our presentation, one area of law that's going to be significantly impacted and probably the basis for a lot of litigation is going to be your anti-discrimination set of laws. That set of laws is codified in the Americans with Disabilities Act and on the state level, the Fair Employment and Housing Act. So with all these changes in the law, Nancy and I can't stress to you enough how important it is for you not to overlook a law. And that's where you turn to your HR folks, turn to your legal advisors, and let them worry about making sure you're in compliance so that, again, you can focus on whatever it is your business is and get back to making money. That's sort of the high-level introduction. It sounds a little bit bleak, but I want to make this a very positive presentation. And let's talk about collaboration. How can employers and employees continue to work together if you're already back in business, or get back and open up the office to make sure you're successful in your businesses? Well, I would start by talking on the employer side. I think one of the key things that you can do, depending on the size of your business, is to put together a team of people, a team of trusted individuals that you rely on to not only advise you, but also to help you implement and speak with the employees in your office to make sure that everyone feels safe and comfortable in their profession. Some of the individuals that you might want to put on this team are people with human resource backgrounds. If you have a business with a human resource designated individual, folks that work in facilities or your facilities vendors, for instance, are great folks to talk to you about. We'll talk a little bit later, but about reconfiguring your office to make things more comfortable and comply with city and county regulations and orders. Your operations folks are usually working hand in hand with your facilities folks. Also, IT is critical. A lot of people are having people work from home now as an accommodation. So ensure that your IT folks know what your employees need to feel supported and continue to do their job, whether it be remotely or in the office, just in a new work environment. Last but not least, certainly your legal team. It's much easier to deal with questions and advise on the front end before you make a decision that could potentially create a liability for your company. So reach out to either your on-staff legal advisor or to an outside attorney like Nancy or myself. On a very high level, some new areas that you need to be aware of include new postings that are required at the state, the county, the city, and the federal level. I'm sure a lot of you already have postings in maybe your break room or somewhere in your office. Understand that the Department of Labor and state agencies have now updated their posting and updated their posting requirements. So you want to be sure that you are posting the most up-to-date COVID-specific postings. Documentation. Documentation is can be your best friend, but it also can be create a nightmare for you down the road. Documentation can really help show all of your efforts, all of the work that you've done with your employees to comply with the COVID regulations and new laws. But you want to be very careful with documentation, because if you make an error and you document that, it's certainly probably going to turn up later on as a piece of evidence in court. So let's talk about where we're at as a state and sort of as a country getting back to business, right? So California is working their way through what's called a phased reopening. And it's critical to understand that each business's approach to this reopening is, like Nancy mentioned, it's kind of a gray area. It's not a tailor-made approach for every single business. You have to analyze what business you're in, how your customers are coming in and out of your place of work, how your employees are entering the building, exiting the building, where they're sitting. All of these are business-by-business analyses that must be addressed on a specific level. As many of you know, California, like many states, has taken this phased approach, and right now, on a statewide level, we are in phase 2. Phase 2 of the stay-at-home order was rolled out just about a month ago on May 8th, 2020. That covers businesses that the state has deemed safe or lower-risk workplaces. Some of the businesses that fall into stage 2 include retail-related businesses, logistics and manufacturing companies with warehouses and things like that have larger footprints, so it's easier for people to social distance and spread out while working. Office workplaces are under the stage 2 phase, and then limited personal services are also in stage 2 that are reopening. Some outdoor museums and some childcare, which I know a lot of you are probably happy to hear, are also open now. So you can get your children back to things like childcare or camps during the summer, things like that, so you can focus on your work if you're working remotely. As of Tuesday, this past Tuesday, a week ago, there was all but five counties in California, of the 58 counties in California that have completed the phase 2 process. The only counties that I'm aware of right now that are not fully out of phase 2 are Alameda, Imperial, Marin, San Francisco, and Santa Clara. Going forward, for those of you who are not familiar with the phases, there's 2 more phases that we have to work through as a state. Stage 3 involves the higher risk workplaces. Those are going to be like limited personal care individuals. Some of you might have businesses in that sector, and then recreational areas. I know a lot of you, myself included, are sad that sports haven't yet returned, but hopefully that's on the near horizon. Also in stage 3, travel is going to become permissible for activities like healthcare and food and things like that. And then a lot more of the micro level local activities like shopping are also going to reopen. For instance, restaurants in Santa Clara County have opened up their patios, but if they don't have a patio, they can only do takeaway. So as we enter stage 3 and 4, those are going to open back up like normal business, of course, with some alterations. Finally, stage 4 is the end of the stay-at-home order. That's going to be a gradual reopening of larger venues like your sports facilities, your nightclubs, your concert venues, things like that. That, of course, is going to be the last stage, and we're not entirely sure when that's going to happen. Some folks are thinking it might be in the fall, September, October timeframe, and I've heard others speculating that it might be early 2021. When we talk about, I talked about the team that you want to put together. So for those of you who have not returned employees back to the workplace already, we need to talk about who you're going to allow to come back in and how those decisions are made. Now, if you're a small business, it makes a lot of sense where maybe you just return everybody back to work all at once. If you're a larger business and people are going to be a little bit more crowded back in the workplace, you could think about potentially a phased approach where you're returning groups of employees back to the workplace in sectors or teams, smaller teams. What I want to stress there is if you go with the phased approach, the team approach, it's important that you make your decisions as to who is going to return to work based on neutral categories. So you can't make these decisions based on protected categories like age, gender, race, or medical disability, for example. This is a great area where you talk to one of your attorneys, talk to someone like Nancy or myself, and we can help you come up with a game plan as to getting back to work. And with that, I will turn it over to Nancy.
All right. Thank you, Michael. So yeah, return to work is a really hot topic, and not simply because the law says there are all these obligations. All of that has kind of been turned upside down with this pandemic and health crisis, so that it affects the doctor's office, the law firm, the dry cleaners, the restaurant, in all different levels. And so thank you, Michael. That's amazing insight and very helpful. So one of the things as an employer or an employee, everybody's heard of FMLA. And there's always, I've represented a lot of employees, and sometimes there's misconceptions about what that does entitle to and what it doesn't entitle you. And that too has been affected by COVID, and a new law was enacted, Families First Coronavirus Response Act. And I'm going to let Michael share about that in a moment. But traditionally, what is FMLA? Well, it depends upon the size of your employer. It also depends how many hours you've worked for that employer, whether you are entitled to FMLA leave. Typically, it gave security to the employee who needed to take time off to care for their own serious medical condition, or a family member who has a serious medical condition. Could even be, baby bonding time or time with children. And when coronavirus first hit, at least it became, there's all kinds of theories about when it started and came to the US. But let's go with the March 19, 2020 date, that employees started doing remote working. And for us, at least in the legal profession, it was literally overnight. Everybody get out of the office, grab your laptops and go home. It wasn't a gradual transition at all. Even courthouses were shut down in literally a matter of hours. And so traditionally, those employees who want to say, well, I need to stay home because my kids are home now, they're not at school. Well, that traditionally isn't covered under the traditional FMLA. Or I'm afraid to come to work because I just don't want to catch the flu or get sick or get COVID or anything like that. And that traditionally wasn't covered under FMLA. So I think our legislature reacted to that and then enter the Families First Coronavirus Response Act. Michael, tell us a little bit about that.
Yeah, absolutely. Thanks, Nancy. On March 24th, 2020, the federal government announced that they were going to implement a new law, set of laws, I should say, in response to the COVID pandemic. This set of laws on the highest level is called the Families First Coronavirus Response Act, quite a mouthful. And the FFCRA includes both an emergency paid sick leave component and also an emergency family medical leave expansion act. So as Nancy talked about the FMLA, which is still in effect and will be in effect going forward, there is a supplement now that you need to be aware of, and that is the emergency FMLA. And so that is more of a supplement. It does not replace it. And that all went into effect on April 1st, 2020. Since that law went into effect, there was great confusion on the business side of things as well as in the legal community, because there was a lot of unanswered questions. Over time, the federal government started rolling out some guidance, some frequently asked questions that they were dealing with. The last I saw, the list of FAQs is somewhere near 100 now. So it's an incredibly complex and confusing area. But again, this is sort of the situation. We're dealing with a live and very fluid situation with a brand new law that even the regulators and the politicians in Washington, they did their best to try to anticipate what would happen and what the impacts would be, but now we're actually dealing with the practical side of things. So the FFCRA applies to employers with under 500 employees, and let's see, and sorry about that. So over the past 4 weeks, there have also been several paid sick leave laws that have been rolled out, as I mentioned at the outset, on the state level, on the county level, and on the city level as well. So many employers were left out of the FFCRA and employees as well. And so cities have supplemented that law to give basically the same coverage that the FFCRA has to those employers and employees that weren't otherwise covered. Several cities in the Bay Area, for example, like San Jose and San Francisco and Oakland, have rolled out things like the COVID-19 paid sick leave ordinance, and that again supplements the FFCRA. An overview of the FFCRA, again, this is very high level, is that employers with fewer than 500 employees who are subject to what's called the Fair Labor Standards Act must provide every single employee with 2 weeks of paid sick leave that can be used when the employee is unable to work because of 6 specific reasons. So the 6 specific reasons where this new law comes into play are the following. The employee is subject to a federal, state, or local quarantine or isolation order that is related only to COVID-19. Number 2 is the employee has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. So those individuals that have symptoms related to COVID-19 and have actually seen a medical provider, that would be a covered reason where the employer would have to provide the emergency paid sick leave. Number 3 is an employee is experiencing seeking symptoms and is in the process of seeking medical advice. That person is also going to be covered. So if you have an employee who has a cough or has the chills or a fever, and they say, I need to go to see a doctor because I might have COVID, that's going to be a covered reason. So this paid sick leave is going to kick in, and their time away from work is going to be compensated. Number 4, the employee is caring for an individual who is subject to one of the orders that Nancy and I previously talked about. That person, if you've got a dependent or say an elderly parent and they have COVID or COVID-related symptoms, that also is most likely going to be a covered situation where the paid sick leave is going to kick in, and the employer is going to be responsible for paying that employee when they're out of work. Number 5, the employee is caring for a son or daughter whose school or alternate care has been closed due to COVID. For instance, now that we're entering almost officially the summer months, a lot of your children are done with school, but their camps might not be open yet, or their secondary places of coverage might not be open, like daycares. In those situations, the employee is also entitled to take leave and get paid for it for up to 2 weeks under this new law. Finally, the employee is experiencing any other substantially similar conditions specified by the Secretary of Health and Human Services in consultation with the Secretary of Treasury. Now, what does that mean? Well, again, going back to the Department of Labor and their frequently asked questions, they have put out a lot of advice and guidance as to what these substantially similar conditions include. So how do you calculate paid sick leave? Well, we talked about it being 2 weeks, but what does that mean? How can employees take it? Do they have to take it in 2-week blocks? And for the folks on the call that have hourly employees, how do those folks take their leave? Or part-time employees, how do they take leave under this new law? So for full-time employees, the 2 weeks of paid sick leave automatically equates to and is capped at 80 hours. So they're taking a traditional 40-hour work week and applying that to the full-time employee. So that one's pretty simple. So for part-time employees, the 2 weeks of paid sick leave equates to the average number of hours the employee works over a 2-week period. So generally, the quantity of paid sick leave hours to be allotted in a single day, for instance, if an employee is only working 4 or 5 hours, the allotment of paid sick leave is based on that employee's normal schedule. So if someone's scheduled for a Monday for a half day, 4 hours, that's pretty easy to figure out, but then you would owe them the 4 hours under the law for paid sick leave if they're unable to come to work for one of the 6 reasons that I discussed. The FFCRA also imposes minimum amounts of compensation that must be provided to the employee and exceptions when the employee can use sick leave under conditions number 4, 5, or 6 that I talked about. So as you can see and understand, this gets extremely technical and is very determinative on the individual employee. So again, this is a great area where you're going to want to work with your human resource folks or outside or in-house advisors as to whether or not a potential leave or a leave requested by an employee is covered, and then of course you would need to pay that employee. Caps in terms of level of compensation, the FFCRA places monetary caps on compensation to employees for certain uses of paid sick leave. For example, if an employee takes leave under the first, second, or third reasons that I discussed, the cap payment to the employee is $511 per day, and the total amount that the employer would need to provide to the employee is $5,110 in the aggregate. Whereas the employee who's taking sick leaves under 4, 5, or 6, the cap for the employer is $200 a day or $2,000 in the aggregate. If an employee is seeking leave for any of the permissible reasons that I mentioned, an employer can't require the employee to use their other banked paid sick leave. So if you have employees that are banking per policy or under California law or state law, other paid sick leave, you can't force them to exhaust that bank of leave before you allow them to take leave under the FFCRA. I think that's an important point. Prior to the outbreak of COVID-19, San Francisco and Oakland, for example, and I believe LA as well, had their own versions of paid sick leave laws already in place. And so San Francisco was actually the first city in the entire country to pass their own sick leave ordinance. So again, that law is going to remain in place, but a place like San Francisco has already supplemented their own paid sick leave. So it's kind of hard to track, but you want to make sure you're complying with the most current paid sick leave law that's on the book. Also, some other things to consider when employees are back to work, if they're not already, or if they are, you want to take into consideration things like PPE. For instance, under California law, an employer is required to provide or to reimburse their employees for any materials or any expenses that the employee incurs related that are necessary for the employee to incur related to the discharge of their duties. So you want to think about if a county like Santa Clara, for example, where I practice, companies are required to have their employees wear protective face masks in most situations when they're back in the office. So a thing like in Santa Clara County, a face mask would be required to be paid for by the employer. Other areas you want to think about are things like gloves and hand sanitizers. From the employer perspective, those are going to be costs that you want to bear yourself and not pass those on to the employee. Now, a great question that we had a client ask me about is, what if my employee wants to wear a designer face mask or a different kind of face mask than the one that the company provides? Does the company have to pay for that? The answer is no. The employer has to pay for sort of, I don't want to say the bare minimum, but has to provide for a medically proper face mask covering. And then if the employee wants to upgrade to another nicer mask, the employee can pay the difference. And with that, I will turn things over to Nancy, who's going to talk about unemployment benefits.
All right, so the next topic, and it's a combination of unemployment benefits, and we should have titled it Unemployment and Workers' Compensation. And Michael and I are going to kind of take each subject separately. So first, Michael, would you mind sharing with us on workers' compensation? And that's a big, big topic for both employers and employees because, obviously there's different perspectives. And laws in California are extraordinarily changing and very kind of broad in favor of the employee in these situations. So, Michael, can you share with us the recent change in executive orders regarding employees with COVID that reported as an on-the-job injury?
Yeah, absolutely. Thanks, Nancy. So just recently, Governor Newsom in California rolled out Executive Order N-62-20, and this is really significant in light of and in response to the COVID pandemic. What that executive order does is it basically creates a time-limited rebuttable presumption for accessing workers' compensation benefits applicable to all individuals in California who must work outside of their homes during the stay-at-home order. So those employees that are deemed essential or working in essential businesses, there is now a rebuttable presumption that if an employee gets sick with COVID, the employer is going to be forced to rebut the presumption that the employee became sick at work. So it's extremely significant, and you need to think about what that means in terms of your process and operations going forward. The state of California, according to Governor Newsom, wanted to remove the burden from workers on the front lines. Those individuals, like many of your employees in the medical field, for instance, or those individuals, a lot of whom are like in the Central Valley processing the state and the country and the world's food, are back on the front lines and processing things on a daily basis. So the governor decided that, and the state decided that they needed to add another layer of protection just in case employees do get sick at work. That being said, there are ways to rebut the presumption that have been set forth by California. So again, this is an area, without getting too much into the weeds, where you're going to want to talk to your legal advisors as to how do you rebut the presumption, and ideally, how do you prevent individuals from being contaminated while in the workplace. So the people that are eligible, if they test positive for COVID or were diagnosed with COVID, that's the employee where this new executive order is going to apply. The positive test, once they start displaying symptoms, has to come within 14 days. Otherwise, that rebuttable presumption falls out of the picture. The COVID pandemic is obviously something that impacts, as Nancy said at the outset, just so many different areas of law, and workers' compensation is not one of my strengths. So I can tell you that, again, this is an area where you're going to want to speak with HR folks and speak with attorneys on the front end rather than trying to cover your tail on the back end. And then there was also some significant developments with respect to unemployment and unemployment benefits, and Nancy's going to discuss a little bit of those.
All right. So, and some of you might wonder, I'm an employer. I run my business, my medical practice, my law practice, my dry cleaners, my restaurant. What do I care about unemployment benefits? Well, what happened with COVID is that some laws were enacted which allowed actually business owners and self-employed whose businesses were shut down and had no source of income, including dentists, professionals, anybody self-employed or business owners, to apply for unemployment. And that was unprecedented. It was up to 39 weeks, and under the CARES Act, it was an additional $600 a week. Now that's CARES Act $600 a week ends in July. I'm not sure when, but I know it ends in July. And so this was very unprecedented, because when you talk about unemployment benefits, you're talking usually only about employee applications, et cetera. So that was something I thought very interesting, and a lot of my corporate small business owner clients whose businesses were totally shut down for the first time in their lives ever started collecting unemployment benefits. Obviously, once your business reopens and you're earning an income, you're no longer eligible and you need to forfeit them. But it presented a lot of questions. In other words, if an employee's hours are cut, is he or she entitled to unemployment? Under this kind of new emergency laws that an employee whose hours were cut, an employee who was furloughed, in other words, they just got their benefits, but they get no paycheck, that they would be eligible under the CARES Act to collect unemployment benefits. It was a massive influx, and there were something like in the first month over 3 to 4 million applicants for unemployment benefits, and it just totally flooded the system. But they were still able to, roll out. It's like pretty much a debit card that some of my clients got for the first time in their lives. Of course, now they're looking forward to this phased reopening and going back to work, kind of in an orderly and compassionate and humane way. That's really, really important. So, but can you collect unemployment if you're remote working and collecting your paycheck? Obviously not. There's always dangers to trying to double dip, whether you're the self-employed or the small business owner that's collecting these benefits, or the employee who's been furloughed. So, but that was something unprecedented. It is temporary. And I don't think it will be in effect very long. Unemployment benefits for business owners and self-employed continues through December 26, 2020. And as I said, that extra $600 under the CARE Act ends in July. So, lots of interesting things and new laws that are changing, probably will change back once the waters calm a little bit. Next thing we want to talk about, a very, very hot topic, is workplace accommodation. And so you, in the ordinary normal times pre-COVID, accommodating an injured employee, someone injured on the job, someone who's got a medical condition, physical disability, any kind of those situations that puts you in what's called a protected classification, you as the employer have to sit down and have this kind of meaningful dialogue, a meaningful back and forth. As the employer, hey, how do I help you, Mr. or Miss Employee? And as the employee, hey, I look to my boss for help because I love my job and I want to get back to work. So the two sides to workplace accommodations are, what is a reasonable accommodation? How do you define it? And how do you define it post-COVID? And number two, what can the employee do to request assistance from the employer? So kind of the employer's perspective of offering a reasonable accommodation, and that's the legal term. And then the employee's request, what can the employee ask for that's equally reasonable? So Michael, I'll let you share a little bit your experience and thoughts on defining what a reasonable accommodation is in the post-COVID workplace.
Yeah, thanks so much, Nancy. And my comments, folks, are going to be tailored to, the laws are going to be neutral, but a lot of my comments might be a little bit more tailored to the employer perspective. And I know Nancy's going to supplement and fill in the holes where I leave out for the employee's perspective as well. But as we discussed, this is really the accommodation issues go hand in hand with what is called the interactive process. So we really want to emphasize both the company and the employees to take a collaborative approach as we get back to work. The reasonable accommodation laws across the board in the United States are very robust and have been very well litigated. So there's a lot of specific examples as to what will and what will not violate the reasonable accommodation laws. And of course, again, going back to California being the Wild West, we have the most strictest laws in the entire country. And so it's incredibly important to work with counsel or HR folks to understand what needs to be accommodated and what doesn't need to be accommodated. Let's not forget that, employers have rights too. And there are certain asks that an employee might ask of you in returning back to work that you don't need to comply with. For instance, one of my colleagues dealt with a situation where they're back to work, their client's back to work, and one of the employees told the employer that they didn't want to wear a face mask at work. They didn't like it because it restricted their breathing, but they didn't have any medical reason, and they didn't have any other reason why they didn't want to wear it. They just didn't want to do it. So how do you deal with that? And do you have to force them to wear a mask? Well, you can't physically force anyone to wear a mask in your place of employment. I promise you that will result in a lawsuit. But what you can do in a situation like that is you can go through your normal and regular disciplinary steps that if someone is being insubordinate or if someone is refusing to comply with a city, county, or state regulation or law, then what you'll do is you'll counsel that individual, and you can include things like a written warning, documenting it otherwise in their file, or asking the employee to return home until they're ready to comply with the obligations of the workplace. Nancy talked about what is an accommodation, what's reasonable and what's not. Those are some legal technical terms that have been created over time in the courthouse, and so we'll provide you with a high level of what all that means. The accommodation laws basically impose a duty for an employer to accommodate an individual, an employee, with a physical or mental condition that limits major life activity. And there is a long list in California and federal law of what is a major life activity. But since we're talking about getting back to work, I can shorten that list and say that working is a major life activity. So if one of your employees has a physical condition, COVID related, or a mental condition, for instance, we're hearing a lot of our clients having employees that have debilitating anxiety, where they don't feel comfortable going back into the workplace because they're fearful that they're going to catch COVID from one of their coworkers or from an unclean work environment. How do you deal with those folks? And I know a lot of people probably that are listening to this presentation, given that half the audience is from the AAMS, you probably have been involved tangentially with the accommodation process. As an employer, you can require your employee to bring in a doctor's note that sets forth what medical restrictions the employee has, so that then the employer can look at those restrictions and determine whether or not they can or cannot reasonably accommodate the medical restrictions that were imposed by the employee's medical provider. So certain accommodations that must be at least explored in California, for instance, include a modification or an adjustment to the workplace. And this is something post-COVID and during COVID, where you should be thinking about, as I mentioned, working with your facilities and operations teams to redesign the layout of your business so that you can reduce employee anxiety and concerns about interacting with potential contaminated workspaces. One area where we're advising our clients is things like conference rooms to space out the chairs or remove some chairs so you can maintain some good social distancing practice while at work. That's one way to accommodate someone at work in larger group settings. Other ways that that California has defined reasonable accommodations include things like job restructuring, figuring out what jobs are essential and what job duties are not essential. And if a job duty is not a non-essential duty, the employer is going to be obligated to reassign that duty to someone who does not have a work restriction. Also, modifying how, when, or what capacity the employee returns to work. Thankfully, with technology, it's been very fortunate for a lot of people, myself included, that we can work from home as long as we have a computer and internet. So those businesses, those employers that have employees that can continue to work from home and be efficient and complete all of their essential job duties, it's probably going to be interpreted. It hasn't yet on the books in California been interpreted, but what's forthcoming is that a reasonable accommodation is most likely allowing the employee to continue to work from home. Now that sort of gets into another gray area as well, because if there are some duties that an employee is able to complete at home, then you have to allow them most likely to continue those duties. But if there are certain job duties that can only be completed in the office, then and the employee cannot go into the office for a medical reason because they have a medical restriction, then you can do things like potentially reduce an employee's salary and working hours for the hours that they're unable to complete their other assigned duties. Again, I can't stress enough that the accommodation area of law is incredibly fact-specific, and it's also very heavily impacted by things like the job that you're in, the job that the individual is performing, and the layout of the workspace. So, for instance, someone who's working on a manufacturing line, their essential duties are going to be much different than someone who's working in a doctor's office at a front desk, or potentially one of your doctors who's up and around and moving around the office in a closed environment, potentially with sick patients. So that analysis really needs to be done on a case-by-case basis to determine what is and what is not a reasonable accommodation under the law. Also, a potential reasonable accommodation might be moving someone to a new position, a new job where you can allow them to work, allow them to continue to make money, but not have to do their former job. Now, you don't have to create a new job for the person. You only have to move them under the law if there's a vacant position that's already available and for which that they're already qualified. Very important, like I said, an employer is generally not required to eliminate essential functions of an employee's job altogether. While you should evaluate whether or not job duties can be reassigned, essential job duties in California don't have to be offloaded and create a burden for one of your other employees. If an employee is unable to perform the essential functions of their position with or without a reasonable accommodation, and the requested accommodation by the employee is reassignment, the company does have to make a good faith effort to determine whether the company has an available position to which the individual can be reassigned. And a good faith effort is evaluating top to bottom all of your open positions and then looking at that person's job qualifications and their capabilities to determine whether or not they can complete those functions. If the company determines that there are no available positions that are currently vacant for which an employee is qualified, the company is not required under the law then to reassign that employee. Their responsibility to reassign a disabled employee or an employee with a physical or mental health limitation who cannot otherwise be accommodated does not require, again, like I said, creating a new job or moving one of your other employees to a new position to then create that vacancy. What is required, however, is the duty to reassign a disabled employee if there's already a funded position available. As I mentioned earlier in the presentation, documentation in this sector of laws, the accommodation and the interactive process, is absolutely paramount to defending yourself on the employer side from future litigation. Documentation of all the efforts that you've made, whether it be direct documentation with the employee or communications with the employee's medical provider, and also conversations that you have internally with HR and your legal team. Now, some of which, of course, are going to be covered by attorney-client privilege, but all of those documents are going to help recreate the story and recreate your efforts to reasonably accommodate your individual employee that has asked you for an accommodation. Again, this is an area of law that has already been heavily litigated. It employs lots of attorneys already. And as this sort of return to work phase 2, 3, and 4 happen in California, you're going to see an enormous wave of litigation probably in the next 4 to 12 months, I would think. In California's laws with respect to accommodation, discrimination, and the interactive process fall under what's called the Fair Employment and Housing Act, and the federal counterpart, as I mentioned at the beginning of the presentation, is the American with Disabilities Act. And Nancy is going to discuss some employee requests related to being accommodated and how they can get back into working.
Thank you so much. One of the things, I'm in trial quite frequently. It'll be a while before I think I'm in a courtroom again because of COVID. But one of the things that I enjoy best about being in trial is you get to talk to juries after a case. And whether I'm defending a case for an employer or prosecuting a case for an employee, I love speaking to the jurors because it is the most best education you get from these 12 people who sit in a box and get $15 a day to tell you what they think about how the employer and employee have behaved with one another. And one of the things that they always want to focus on is, was there this, did they sit down and talk? And not necessarily like a kumbaya hand holding, I'm going to give you roses and chocolate and I need you back, you're a wonderful, valuable employee. But is there this was the employer fair? Did they sit down and try to help each other? And so, while the law gives us a lot of examples of what an employee can ask for if they need an accommodation. And now it's even broader under COVID, but some examples, and I think this would apply to a medical practice, a law practice, a lot of service-oriented businesses, is that, what are the disorders or anxiety? If I have an employee who comes in that has post-traumatic stress disorder from this whole COVID experience and has a letter from a doctor saying she's been diagnosed with PTSD, which is not very difficult to get. The law says that major depression and anxiety disorders, agoraphobia, post-traumatic stress disorder, obsessive compulsive disorder, even claustrophobia are all medical conditions that require accommodation. There was a case a few years back of a gentleman who worked for the city of Bakersfield, and he was a social worker. He worked in the welfare office, and he developed agoraphobia and had a fear of the public. And so they said, well, you've got to deal, it's an essential part of your job, and they terminated him. And a Bakersfield jury gave him several $1 million because under the law, that is a medical condition or physical disability that must be accommodated. So it's not, again, this is the law for this work setting versus the doctor's office versus the law practice or whatever your business may be. It changes. And the key test is what is reasonable. So if it's a situation where your employee comes back and they need a little bit time to get used to the workplace, it's going to be like starting a new job. The workplace is going to look very different. Some people might want to wear masks. I have some of my employees want to wear masks, some of them don't. We alternated work schedules. I was trying to be fair and reasonable because I don't want anybody to feel safe and insecure in the workplace. And that's the same advice I gave to my clients. So that back and forth dialogue is really important. I think COVID has changed the degree of privacy an employee can get. So employers now can more easily require doctor's notes, fitness for duty evaluations from an employee who comes back and says, well, I now have post-traumatic stress disorder and I need to be working from home. I can't deal with the public anymore. I can't talk to people. And I think one of the many things that this pandemic has taught us is the value of human interaction. I know I miss it with my clients. With my mailman doesn't deliver mail anymore, with the UPS guy, in different facets, that human interaction is so key to our fulfillment in our jobs. And that's changed, and that's going to be very, very different. Depositions, as Michael was saying, is now sitting in a conference room 6 feet apart, or maybe doing meetings by Zoom. So I think in the end, there's no book or manual that's going to tell you this is reasonable and this isn't. I think it's important to just sit down, be honest and open, and have that back and forth with an employee, and try to balance meeting the employee's needs versus meeting the employer's needs. Because as Michael said, you don't need to create a job for the employee. You don't need to hire an assistant to help the employee do his or her job. For example, if your employee tells you, I don't want to deal with the public anymore, well, you don't need to hire a receptionist now because this person doesn't want to work in that capacity. So again, what is reasonable really varies case to case, and Michael really emphasized that very appropriately. I want to segue a little bit before Michael shares his closing thoughts on, the theme that Michael came up with for today's was working together, and it is a true collaborative effort, not just with the employer and their HR go-to person, their go-to attorney, or their go-to advisor or financial consultant to help them run their business now post-COVID, but really working together and collaborating between the employer and employee. It's very, very important. And that sit down and that talking and that just listening goes a really, really long way to trying to rebuild your business, whatever your industry may be. And we all need to do that now post-COVID. But one of the other things that will come up, I think, in the work setting is retaliation. And we've seen a lot in the press lately about doctors who are retaliated against and nurses for complaining about the lack of, personal protective equipment or falsifying cause of death on a death certificate in a hospital. And I've gotten inquiries from some corporate employers that I work with in the medical field on that issue. And when you come forward as a doctor, when you come forward as a nurse, albeit a very brave decision, but the right decision, because in the end of the day, it's about patient safety. You are now in a protected class, and your employer, whether it's a hospital, a medical facility, whatever it may be, can't fire you for coming forward and speaking out. We've heard a lot about some rehabilitation or convalescent facilities where nurses have refuse to show up for work because they're not provided personal protective equipment. Rules of hygiene and social distancing aren't being respected. Visitors are being allowed, those kinds of things. And I think that's going to create a lot of litigation on retaliation claims in the workplace. But that is a discussion for another day. And I will turn it over to Michael out of respecting our schedule and not doing the Armenian timing thing. Michael, will you share with us your closing thoughts on working together, employers and employees?
Absolutely. Thanks, Nancy. And, you know, Nancy brought up a great point about the retaliation area of law. And there are so many other areas of law that we were not able to dive into just due to the time constraints. For instance, you want to pay attention to things like harassment at the workplace, where if you've got employees giving coworkers a hard time because they heard they might have COVID or they have a family member that has COVID, that's going to create a ripe environment for a harassment claim. Nancy talked about the privacy issues that she's dealing with. And I want to talk to you very quickly about some privacy concerns, because in Santa Clara County, for instance, and I know other counties as well, a lot of businesses, the county is requiring businesses to take temperature checks for employees as they either walk into the building or as they prepare to go to work. That implicates not only privacy concerns as to what information you're recording and keeping on your employees, but it also implicates wage and hour law in California, which hopefully none of you have dealt with a wage and hour lawsuit. It's where I live most of my world. It's an enormous body of law in California, but if you're making and have to make your employees take a temperature before they come in the building, or if they're taking it at home, their own temperature, that's going to be compensable time. So you have to make sure that you're building in compensation for whatever time that individual is waiting to have their temperature taken. That being said, I just want to say thank you so much to all of you who have joined us tonight. And I know this presentation is going to be posted on Facebook and YouTube and the ABA and AAMS's website. So thanks for tuning in, folks. We appreciate that things are changing extremely quickly on a day-to-day basis. And so that creates naturally a great uncertainty with the state of the law and the obligations that employees and employers have to abide by, right? The landscape, as we know it, has totally changed. There is no sort of unbanging the drum. We can only work with what we know, and as things change, we're going to adapt and we're going to be successful. Through the collaboration and transparency that we've been talking about for the last hour, working with your team that you've assembled on the business side of things, you're going to be successful, you're going to get through this, and you're going to get back to making money, which is the most important thing. Nancy and I would like to thank you all so much for joining us, for your time and attention over the last hour. We'd also like to thank so greatly the efforts and collaboration of the Armenian American Medical Society, the Armenian Bar Association, and everyone that was working extremely hard behind the scenes to get us together tonight. With that, we've reserved some time at the end to field some questions from the audience. If anyone has anything, or from Facebook, please let us know and we'll address those.
Great. Thank you very much, Michael and Nancy, for that very, very informative talk. I mean, it was truly a lot of information that you guys tackled so eloquently in the allotted time. And I can only imagine there's going to be a robust discussion. We already have some questions coming through from Facebook. Michael, if you can stop sharing the screen so that we can have you back. And you saw our two colleagues' contact information. If anybody needs their contact information, by all means, you can reach out to us, either organization, and we'll share that to you. Gerard, there's any comments from your end?
I see, actually, I see a question on the Zoom platform that I'd like to ask, which is actually a very broad question. It's just user initials KM. Are there any liability concerns for an employer if an employee contracts COVID at work? Interesting question. Michael, I guess this would be in your.
Yeah, certainly I can start out, and I know Nancy will help me out if I miss something, but yeah, that's a great question. And the answer to your question is yes, there are liability concerns. I think the greatest area of concern for an employer is that if you fail to comply with one of the laws or orders or regulations that were rolled out on the city, county, or state level or federal level, you're going to open yourself up to a negligence case. And that is basically for failing to comply with the law. You've been negligent, and then yes, you could definitely open yourself up there. And that's of course in addition to all the other areas of law that we've talked about with respect to liability, your wage and hour compliance, your compliance with the ADA and with FEHA as well. So there are certainly, absolutely.
Right, and claiming that you did not know that the law existed or anything like that, ignorance of the law is never a defense. So you must know the law. If you don't know it, look it up or talk to your attorney, the people on your screen. If you can, any questions coming from your end?
We have a question coming from Facebook, and this question reads, people are arguing anxiety caused by the need to wear the mask. Employers are requested to accommodate that since it's a disability. If you can comment on that, anxiety being claimed as a disability as a result of wearing masks.
Kind of the reverse argument. It's usually the other way around. I have anxiety, so I need to wear a mask. That's a brilliant question. It's the anxiety that triggers the obligation to either let them wear a mask or not wear a mask. It's the underlying medical condition or physical disability that puts you in a protected group that then allows you to get some assistance or what the law calls accommodation from the employer. What you're asking is, can they refuse to wear a mask?
I believe what the question is a bit vague, but.
Can I have it one more time?
Can you repeat?
Yeah, so people are arguing anxiety caused by the need to wear the mask. Employers are requested to accommodate that since it's a disability. Obviously, evidence is required to back that up, is what the comment, I'm not sure if it's a comment or a question.
Yeah, well, you can't force the employee, and I will let Michael supplement this, but you can't force the employee to wear a mask. You must make it available. This is more from the employer's perspective. It's really kind of an injury prevention program, work comp issues more than accommodation. You just have to make it available. If they don't want to use it, they don't need to use it, but you have to make that, personal protective equipment available. And if they refuse to wear it, you can't fire them for refusing to wear it. But you have to respect the rest of the rules of the workplace that Michael was talking about early on in our discussion, which is the social distancing and things of that nature. I don't know, Michael, I'm probably not answering it, so I'll let you add to that.
No, you did a fantastic job. The only thing I would add, right, and we talked about this a little bit during the presentation, is that number one, if there is a law at either the city or county level that says certain employers have to have their employees wear a face mask while at work, and that employee then refuses to wear a face mask, then the employer can force that employee to remain at home until they feel comfortable complying with the law. That being said, there are situations in cities and counties where a face mask is not required to be at work. And so if the employee legitimately has anxiety, this sort of spills into the accommodation conversation we were having. The employer can request the employee to go speak with their medical provider, obtain a note from their doctor that says, Michael Manoukian has anxiety for wearing a face mask in the workplace. You need to accommodate this work restriction. Then the employer needs to do an analysis as to whether or not they can accommodate that request.
Yes, indeed. I mean, I can share an experience, from my team, and I have to say, we're blessed that we've had a healthy team that has, responded to the needs of our patients to take care of them in a surgical setting. Whereas, oftentimes we are accustomed to wearing gowns and masks and even eye protection. wearing certain types of masks, which is now we all are familiar with the N95 type masks, in addition to a complete face shield, has created a bit of a challenge and a bit of a getting used to, especially in the operating room setting. And I know that some of our colleagues who are in the operative fields, which I see some of them are on this, are participating on this, can probably also share this, where when you're not used to it right off the bat, it does take a little bit of getting used to. And if somebody does have that tendency to be claustrophobic or may have some sort of a breathing issue, it's definitely not for everybody. Luckily, it's something that very easily can be, a person can get used to. However, I can foresee if somebody already is predisposed to anxiety, probably that type of a setting is not right for them. And as you so mentioned, if that company has room for them to do other duties, perhaps they should be doing those duties that don't require those types of restrictive gear that they have to wear.
If I can follow up with this question, so what's the employer's responsibility if its employee, sorry, let me read this. What's the employer's responsibility to its employee if members of the public refuse to wear a mask? So if you're at a front desk, for example, at a location, and you've got all the signs up, no mask, no service, or whatever, and they walk in without a mask, and the employee looks at the employer like, what's going on here? Because when I wear a mask, I'm protecting others. And so if the other's not wearing a mask, then why should I be protecting that person? Or either tear it off or walk away, right? One of those. What would be the employer's responsibility at that point? Or what?
Yeah, I think the simple answer, right, is to think about practically when we go out in the work and in the environment now. Private employers are already addressing that issue, right? I go to a supermarket to pick up some food, and there's someone at the front of the door checking to make sure that someone has a face mask on, and they physically won't let me in the building if I don't have one on. And as a private company, that's their right. They can refuse service to people for not complying with the face mask policy that they've implemented. So that's certainly within a company's right. I think the challenge then is, for folks in the service industry, doctors and lawyers and things like that, how are you going to communicate that? You obviously don't want to alienate the people that are coming to your place of work over an issue like this. So I think really reinforcing why you have the policy, and that it's in not only the safety of the employees, but also of the public in general. I think it's more of how the message is delivered. But at the end of the day, if someone from the public does not want to wear a face mask and follow the policy of the company, the company's free to turn that person away.
Right. How about, I'm getting questions on my, via text message, so pardon me that I'm looking down all the time. Is there an issue of fairness or unfairness if you allow some employees to telecommute who have a special circumstance, such as childcare, or if they have a family member at home who is at a super high risk and they're afraid to be coming in, versus other employees who do not have similar challenges and are not given the same leeway?
I would say the short answer is absolutely. Yeah, the short answer is absolutely. Nancy and I were chatting about this in preparation for this presentation. You're going to have certain employees feel like someone else is getting a better deal. I don't think that's any different than the pre-COVID era. So again, going back to our theme about open and transparent communication, I think that's sort of how you resolve those issues as best you can. Nancy, if you want to please add on, go ahead.
Yeah, I agree with Michael. It's somewhat, in a sense, it could be construed as favoritism, but that would be their, that's kind of an issue that predates COVID. And they are allowed that special entitlement if they're caring for someone who has COVID or have the children at home. This is the new laws in effect that benefit them. So, you know, is there a magic answer to that question? There really isn't, but I think keeping open the communication, and maybe when that employee wants a day off, you give it to them on their day off, you know, you kind of reward loyalty in that way from the employer's perspective. I think that's really helpful because that's just going to happen in any work setting.
Another question. What responsibilities does an employer have to the other employees when one employee demonstrates COVID symptoms?
Go ahead, Michael.
Yeah, I think we talked about this. I touched on this a little bit on the first question that was asked with respect to negligence. The obligation that the company has to its other employees are to protect them and provide an environment that is protected and complies with the law. So again, drilling down to the specifics of the FFCRA and the state, county, and city ordinances, so long as the employer is complying with the variety of those laws and obligations, they have provided a safe environment to the employees who don't have the COVID-related symptoms. The guidance that have been given to us by the various governmental bodies has said that if there's an employee that has demonstrated COVID symptoms, of which there are now many as we become more educated on this disease, an employer is allowed to, under the law, require that employee to leave work and to ensure that they are safe and are not demonstrating COVID symptoms before they come back. And that was really one of the goals of the FFCRA and the paid sick leave laws, so that if you're requiring one of your employees to leave work, they're still going to get paid while they're recuperating from the COVID symptoms.
And to add to that, the employer has the rights. I'll give you an example. I had it was a medical practice client of mine, and they had an employee come back from Italy, like just at the time, I don't know, Viken, you know this better than I would, but there were some rumors that patient zero was this guy who went skiing in Italy and came back to and was released and survived from St. Joe's in Burbank. So they had an employee who came back from Italy at that same time frame when the COVID cases were exploding in Italy. And the question was, can we force her to go get COVID tested? And I said, yes, because as Michael mentioned, you have the obligation to your other employees. And that's something you really couldn't do. It's like a fitness for duty evaluation. And the laws become much broader, and the employee has a little bit of their medical privacy rights kind of etched away because the employer is well within its rights to say, no, you don't come back to work till you get COVID tested. We see the test results are negative and your doctor clears you to return to work. That wasn't that broad pre-COVID. So I agree with Michael that as the employer, you've got to protect both your ill and your perfectly healthy employees.
True. And in addition to that, there are also various public health entity considerations. We've all heard about contact tracing and isolation. For example, if an employee tests positive, it is incumbent on the public health entities to trace who that employee has been in contact with, including people who they've been in contact with in the workplace. And now those employees are in the exposed category, and depending on which public health department municipality you're living in, there may be some restrictions on what you can and what you can't do. I mean, to some degree, this is very piecemeal on how it's being dealt with. In addition, though, in addition to the legal considerations, there would be some public health considerations that employee, employer, and coworkers who may have all been exposed to that person in the workplace would have to comply with, including patients. I mean, just imagine if an employee in a medical office that is open and is seeing patients in person tested positive. Now there's a whole cascade of contact tracing that would need to be done. And if contact tracing is done via textbook, then everybody who's been in contact with that employee would have to be isolated, quarantined, and monitored. So it's one of these like complex interactions of legal matters, the well-being of patients and employees, as well as the public health strategy in mitigating the spread of this pandemic. We have another question that's coming through on Facebook, and it's from the owner of a pharmacy. And she says, if you have an employee who says they get claustrophobic with masks and working with locked doors, and they say that they can't work with these conditions, but will be available to work once we work with the doors unlocked. They gave resignation to leave work and then went and applied for unemployment. First, is there any liability as employer, and will they qualify for unemployment?
Well, I'll answer the second question first. Unless they're fired for theft or they quit, they automatically get unemployment. And a lot of employers try to challenge the initial application, but it's kind of a wasted effort, because unless you got true theft or quitting, the employee's entitled to the unemployment benefits. And if they say it's COVID related and in this climate, then they get it through December 26, 2020, plus that additional money through CARES through July. In answering the first question, I think it depends. Did the employee quit because he or she didn't like the fact that the doors were closed, and were the doors closed because of civil unrest, and pharmacies are an attractive, like liquor stores and beauty salons, or makeup stores, they're attractive to looters. So if it's for the safety of the business and important to run business operations, then as long as the employer has a legitimate business reason for requiring the doors to be locked, and I would say safeguarding prescription medication is a pretty compelling reason, then I think that the employee is being a little bit unreasonable in that situation. I don't know, Michael, if you want to add to that, but that's kind of my 2 cents.
I agree with you 100%. I think the only other optics I would want to know is what sort of dialogue was had, if any, between the employee and the employer, the pharmacy company. If there was none and the employee simply resigned because they don't feel comfortable working with locked doors or personal protective gear, I don't see you being opened up to liability on those facts alone. As Nancy pointed out, so long as you have a legitimate business reason for the steps that you've taken as to the locked door and the PPE, they're going to have a really hard time bringing and sustaining a lawsuit against you.
The only issue I would see there is if these are fire escapes. Being lawyers, we have to just mention that. So if you're locking doors and the doors cannot be opened by pushing or something like that in an emergency situation, then you've created a really hazardous situation. So be careful with that to our pharmacists who are handling that, because often those doors have a sign above it that says this door to remain unlocked during business hours. It's placed there for a reason, because that's a fire exit. We have a question from a Superior Court judge, and we're honored to have him watching today, asking what steps would you expect judges to have undertaken with social distancing protocols in their courtrooms? I'll let Mr. Manoukian answer his father's question.
Well, big shout out and hello to all my family that are joining the presentation. Thanks, Pops, for the question. Nancy and I were talking about the impact of what's happening in the courtroom, right? And again, it's different on a county by county basis. Speaking specifically about Santa Clara County, where I do a lot of my work, the presiding judge basically said that anyone coming in the building needs to be wearing PPE, but once they get into the individual courtroom of the judge is allowed to implement their own rules in their own courtroom, so long as people are protected. In Santa Clara County and a lot of other courthouses across the state, the public at large have been restricted from coming in to review open hearings, which are otherwise open and available to the public. But the courts have all made available an open line for the public to call in and at least listen to argument that's happening and to the process in place. I think one of the positives to trying to keep a positive spin on the presentation is that in the courtrooms at the state level and the federal level, we have been sort of forced to adapt, technologically speaking, to COVID. And I think that's an adaptation that's going to be around permanently. Things like remoting in via Zoom or other video conference and conference calls to present arguments, to represent your client, and are going to be the new norm. So I think the judges in California and across the country are doing a phenomenal job working with the litigants and with the represented parties and non-represented parties to get through this difficult time.
And looks like we have a few comments on Facebook, and they're all congratulatory comments on the great presentation. Our pharmacist colleague who had posed the question, thanks both of you for addressing the real life situation that she had. And indeed, this truly has changed the way, all of us go about our day-to-day activities. And I think that as science is ramping up and in record time, we hope to have, several vaccines available for those who choose to be vaccinated. We all need to be, open-minded and keep the channels of communication open, as both of you stated, just to make sure that we take a common sense and safety first approach to make sure that both the workplace, for healthcare professionals, and whether it be in the courtroom, like for example, I can say from my personal practice standpoint, there's a screening questionnaire that every patient and employee that's going to come into the physical facilities has to answer. And those questions have to be answered as a no, which includes, have you traveled to a high-risk place? Have you been in contact with a person who's tested positive? Do you have fever? Do you have any symptoms suggestive of an infection? Now, once those questions are answered no, then the risk is reduced significantly. Now, in addition to that, we add a brief physical exam of two vital signs, and those include a temperature and a pulse oxygenation, which have shown to be very important indicators of an infection, of an active infection. And if the screening questionnaire, in addition to those two vital signs, which can be done very quickly within a matter of 30 seconds, and if all of these indicate that that individual is a low risk, then we move forward in seeing that person in the physical facilities. Just a little bit of food, food for thought. I'm sure the courtrooms are abiding and following all the guidelines of their municipalities or their counties, public health departments, as well as the CDC. It's been said again and again, but I'm going to say it again. We're all in this together. We have to have, an open mind, and really inspiring lectures from the standpoint of employment attorneys, which, for those of us who have employees, it's like a scary topic, but encouraging to hear that just keep the dialogue, keep the conversation going, communicate, and take a common sense and a safety first approach. I don't see any more questions. Gerard, I'm going to ask you to have the last word, last comments here.
Last comments. Thank you to both of you, Nancy and Michael, for agreeing to present today. Very informative for us. Thank you for representing the Armenian Bar. We're proud of you. And we hope to see you all soon. We have our annual meeting coming up end of June. It's all the information is posted on our website and on our Facebook page. It will be a Zoom conference. It will be from morning until early afternoon. This is in lieu of our originally scheduled annual meeting that was supposed to take place in Armenia in April during the genocide commemorations. So we welcome you all to our annual meeting, and great presentations again. Dr. Sepilian, always a pleasure to be partnering with you and your team, and we look forward to doing many more. Thank you.
And real quick, Michael, thank you very much. And Judo and Viken, thank you to the Armenian American Medical Society and the Armenian Bar Association, very dear to us, for the given opportunity. Thank you very much, and good night, everyone. Thank you.
And please look at the camera and smile. Here's a screenshot coming. All right. Good night, everybody.
Good night. Bye.